What's going on, everyone? I just wanted to introduce you guys to Dr. Santos over here, Dr. Frank Santos, who's been working in the Bayshore Medical Center in East Orange Hospital as an ER physician and amongst our front line in battling the COVID-19. So, how's it going, Frank?
It's going well, Chris. Thanks for the invite. Hopefully, everybody's safe and everyone's well here on your Instagram.
No, I appreciate this. I know you're really, really busy right now with everything going on. This pandemic is absolutely chaotic, and really, as much as we wanted to be prepared for this, it definitely took us by storm. So you mind just telling the viewers a little bit about yourself?
Yeah. So I'm 20 years retired from the military as a emergency medicine doctor. Been working on and off at Robert Wood Johnson, New Brunswick, and recently just started working predominantly at East Orange and Bayshore Medical Center, which is where I'm currently at. And tonight, like about this, get a few hours of sleep, and I'll go back to the department at Bayshore.
Oh wow, that's pretty incredible. And I know you mentioned that you're a life coach as well, correct?
Yeah, and I'm a life coach. I'm all about mindset, positive thinking, success coaching, which honestly is playing a massive role in getting me through this, and I'm trying to get that impression increase to my patients when they get diagnosed with the COVID, which is a challenge for them to get that diagnosis.
Wow. So let me just ask you a really basic question to start this off. Just to make it a little bit easier for everyone. So, how is the COVID-19 different than the flu?
Well, the COVID, you first start talking about the death rate. So, as you see, as we're all here in the virtual landscape with you, the COVID-19 has a death rate. When the first estimates came out, we're saying 34% death rate as a composite for everyone that gets sick. For the elderly above 65, 7%. But now there's some good news that just recently in the Lancet Journal of Infectious Disease, they were now saying that the probably less than that, more less than 1% death rate as a composite. But for the elderly, we're on the acceleration phase of this. The virus is still spreading. It's very contagious. We haven't slowed it down at the plateau, and we're not in the deceleration phase. So we're still in the acceleration phase. Although everyone is quarantining and although everyone's doing the things right, the virus is still out there. It's still contagious. So we have to maintain this quarantine until we get to a plateau where it stops spreading.
Do you think that the current regulations that we have right now are enough?
Well, I think that's the controversy. I think when you look at the map on the CDC webpage, and that's one thing I really encourage, especially as a life coach, is to make sure you're sticking to fact during crisis and not to hysteria. And if you look at the fact, that's the CDC webpage in the your local public health area. What you're seeing on those web pages is that 90,000 New York City, and then you across to places like Alaska, South Dakota, which have less than 200 cases. So there's a big difference between a rural setting and the suburbs and an urban setting. Definitely in the or much spreading much more rapidly. But in order to calm this thing down, we all have to participate, and we all quarantining. And I see some folks out here, even where I live in the suburbs right outside New York City, and it seems like not enough people are taking this seriously. So I really hope that folks listen and stop the spread of this thing and help us get to that plateau.
So it definitely must frustrate you when you see people hanging out on Miami Beach having a party.
Yeah, one of the common questions I get is, when people get diagnosed with this, and we tell them they're quarantined, it's kind of crazy, but they come back and they say, well, do I really need to be quarantined? Can I go back to work? And, the death rate for the elderly is very high. Although 5, I get it, very low. It's more like a flu-like symptoms that these people get. But we need to self-quarantine to help out and to really play together as a team to make sure we get to that plateau.
So, I know how serious this is, and I know it's an airborne disease, from what I understand, correct?
Say it again, Chris, it broke up.
I understand that it's airborne, so because of the fact that it's airborn, if we ever we do go out, to, say example, go get groceries or something like that, right? Should we, what should we do with our clothes that we're wearing?
Well, COVID's a triple threat. It's airborne, it's on droplets, and it's on contact. So, airborne. We used to think that it would just spread 3 to 6 feet if someone forcefully expelled, if they forcefully coughed, if they forcefully sneezed, you're at great risk from people coughing and sneezing. Now it looks like just by a matter of someone has COVID, they can spread it. And as you know, there are some people who don't have great symptoms, so the opportunity to spread simply by speaking is a real threat. I think CDC will be coming out with guidelines very soon, saying if you're in an area like the urban area of New York City, they'll probably recommend a mask to help stop the spreading of it. So I personally wear a mask. I have 6 kids, and I do all the shopping for my house, and I put the mask on when I go out. Absolutely, if you're sick, absolutely if you have symptoms, you should be home. And if by chance you end up going out, you should have a mask on. I put my mask on because I know not everyone's listening to these quarantine effects. I don't want to get sick, so I do wear a mask when I go to the grocery store.
Well, I know you mentioned, I saw an article recently, and I know you kind of touched bases on this recently as well, that just recently an ER doctor actually passed away because of the coronavirus. And I believe you said you know a little bit about that.
He was a partner of mine. A great man. He was a 2-time survivor of cancer. He was a very positive, very caring individual. And I saw him last week on Wednesday of last week. On Saturday, he had fevers, and unfortunately, he passed away in his partner's arms.
Wow.
He was the first emergency doctor to pass away with.
That's wow. That's mind blowing. As far as his partner is concerned, does he, is there any signs of any kind of, does he have the COVID?
Well, I was talking with him on Wednesday of last week, just 10 days ago, and he looked great. But by Saturday, 2 days later, I didn't see him, but I understand he was having body aches and chills, and he was having the fevers. So, I really did my best to maintain social distancing, but of course, it's not always possible. I was in the vicinity of him. I was talking with him. I didn't pick it up. I feel fine, but it is something to consider, though. On Saturday, when he knew he was ill, he quarantined himself and he stayed home. He ended up passing away in his house.
Oh, wow. Wow. So, with that being said, how sick do you need to, do you need to be for you to get tested?
Yeah, so, his example and many other people in healthcare, you're sick with a fever right now and you're coughing, it's presumed that you have the COVID. It's recommended that you actually stay home, you quarantine yourself, that you're not going outside. There's really not a reason to be tested to prove that you have the COVID. Your symptoms are mild. You have symptoms that are, aggressive. We have very difficulty breathing. You have lots of pain in your chest. If your symptoms are more aggressive, then there's value looking for another diagnosis and to get tested. I would recommend. If your symptoms are mild, you have some body aches, you have flu-like symptoms, I would quarantine myself. I wouldn't rush to get tested. There's no point in it. And I would do my best to quarantine myself if I had those symptoms.
All right. As far as our produce and, when we get takeout or delivery or something like that, is there any specific precautions that you recommend taking? Just in regards to the food itself?
Well, COVID's a virus. And so COVID requires a host in order to survive and replicate. It can't hard contact and purposes for a certain amount of time. I think the risk of picking up, an apple or a gallon of milk from delivery and having COVID on it, I think the risk is very low on that. I don't think that's something that I get delivery myself. I'm personally not too excited or too worried about picking up COVID from that. But I am more concerned about going out in public and going to. I think it's more risk going to the grocery store than getting something delivered to your door. Is my point.
Interesting. Because I know there's a lot of fear going out there right now that when people they just eat something for whatever reason it is that someone touched, so there's a possible chance that you grab something off of it.
Yeah, well, and that's where there needs to be a balance, right? We need to make sure our focus stays on facts, not urban legend. It is true that the COVID can survive on hard surface, poor surface. It's not true that we need to be in a panic about all the air that we breathe and about touching everything outside our house. In areas of high rate of people touching, high volume, I'd be very cautious. I would wipe down surfaces. I'd wear gloves. I put on my mask. The thing with the gloves that people say in the contact that you're talking about, if it does contact with everything. When I do go to the grocery store, I'll constantly wear the glove. But I'm very careful to not touch eyes, nose, and mouth. See, if you wear the glove, the impression is fully protected, and I'm totally fine. But the problem is if it's all over your hands because you're touching everything, and you're not then touch your eyes, touch your nose, touch your mouth, you're actually greater risk because of the gloves of getting infected. So if you do wear gloves, remind yourself to touch your face. Take those gloves off and wash your hands before you touch your face.
Okay. Do you have any kind of understanding about what kind of numbers we need to start looking at before, we can start getting back to a regular life, a normal life? Yeah.
Well, COVID is very sensitive, number one, to alcohol. So just to answer your question, so if people are really worried about things with their other things, it takes 70% alcohol wipes and you wipe it down. It's very sensitive. It dies with that. In terms of going back to a normal life, we need to get off the acceleration phase. We need to get to a plateau. Because right now, even though you're quarantined, I'm quarantined, and our lives are negatively impacted, we're not out there, it's still spreading. It's still taking off like crazy. And so it's spreading in nursing homes, it's spreading in hospitals, it's spreading in grocery stores. It's still spreading. We're still on the acceleration. We need to get off that acceleration phase plateau. What people are saying, we had hoped that sometime April 6th, April 12th, that we'd be on the plateau. What they're saying now is that we're 2 weeks behind that. So probably a month be on the plateau. You'll know we're on the plateau because the numbers will stop accelerating. We'll start plateauing. And after that plateau, great news. There's a rapid deceleration after that.
Okay. I mean, do you know of any kind of what they're working on right now in regards to a vaccination?
Yeah, so I think it was University of Pittsburgh just had efforts on a vaccine. There's tremendous efforts being made on a vaccine, which is good news. Viruses mutate a lot, and they do mutagenic drift. And so it's very hard to kill because of that with the vaccine. Good news, COVID doesn't. Good news, there should be a vaccine in the not too distant future. So the vaccine is going to help the rest of the latter part of the year. But for those people who are sick right now, they're working on novel therapy. most likely will come. Vaccine is very possible with the COVID. There's a lot of efforts being done with the vaccine, so I do foresee that happening within the next coming, couple of months.
Interesting.
With that. Hey, Chris, you broke up a little bit. Say it again.
When the vaccine gets approved, obviously gets approved, how long does it usually take before it gets to the mass public?
Well, the vaccines are different ways of making vaccines, but the way they're making this vaccine is very, very quickly expedited. I mean, it'll hit the streets if it's approved and it seems to work in mice. It'll hit the streets very quickly within weeks. People talk about, we're going to have COVID for, the rest of our lives and next year. I don't worry so much about that and another thing called herd immunity will take care of that. But for the people who are sick right now in the acceleration phase, vaccine's not going to make a difference for that. Vaccine short-term strategy is quarantining, working on some novel therapies that we've got going on.
Do you know if there's any anticipation for a second outbreak potentially?
Talking about whether it'll come back next year. In my mind, I tend to be I tend to look on the positive side of things. I think a vaccine will help me to kind of really mute that thought, which meaning that if I get sick, you get sick, other people get sick, we recover. Getting sick again the second time is less. So I think long term we're going to be in good shape. Long term, I think we'll be fine. Back from and interesting. With your business in the real estate market, I have a lot of friends who live in the city who are all saying they're going to move to the suburbs. When you look at the news right now, they're reporting the city, the cases accelerating and the instances in the cities, but the suburbs of New Jersey, why? Not that we don't have COVID, but for the most part, the hospitals in the suburbs are volume less because we don't have the car accidents, we don't have the trauma. People are home. The cities are really overwhelmed.
Interesting. Very interesting. So we should be able to recover a lot quickly than New York.
Yeah, I think so. I think the recovery from this is going to be fast and quick, and that's why folks in my network is let's deal with the crisis, let's deal with the facts, let's be smart about it, avoid the hysteria. If you get sick, we support each other through it. The chance of 5 days is very low. But at the same time, let's start preparing our mindset and recovery, which should be very fast and very quick with this. There should be a fast recovery with this.
Interesting. That's actually very positive news. We've been, when you look online and see, look on Facebook, you're seeing nothing but negativity these days. People are really, really bummed out, and everything that they read on the news or read on another article or something like that, they're just going crazy about it. And, actually speaking with you, being a life coach and everything, being in the front line, you are by far one of the most positive people, I can actually encounter in this, which is why we're doing this right now, because your positivity is absolutely incredible. How's your life coaching, how's your life coach career benefit you in this?
I mean, it's tremendous. I'm doing a lot of, when I can, I'm doing life coaching for free. I'm doing free discovery calls. I'm every day doing free coaching because I'm worried about your finance, money. So I want to make sure that my niche is broad areas. But what's interesting too is that I'm a private interventionalist as well, and so there are a lot of marriage stress, quarantine, right? People dealing with their mother, father, wife, husband, and they're having issues with that. So there's a second virus, and that second virus is the quarantine. And the quarantine is causing damage in itself, damage to relationships, damage to the economy. So not just one. Both require positive mental health.
Interesting. It's a funny story, actually. I saw an article earlier today saying that, married couples that are being quarantined together contemplating divorces right now.
Crazy. There's a lot of that going on. A lot of so it's unnecessary. Now, pain, we can't avoid pain, right? We're going to get pain, but you can't avoid suffering. Suffering is permanent, and you feel helpless in that position. So me and my team, we really work on trying to help people both and the current virus. So I'm a pretty busy guy nowadays, doing what we can and bringing out positive energy, lifting people on up. When I think COVID to someone, I don't simply say you have COVID. I let them know the mindset of staying positive, of maintaining your nutrition, of maintaining your mindset has a great impact on your health.
Interesting. So let's start off opening up some questions for the audience, guys. So if you guys have any questions for Dr. Frank over here, this is a good time to ask it. Anybody?
Yeah, if people have questions later, they can always email me out there too as well.
Sure thing. And we'll also leave this comment box open. Anybody that has any questions or anybody that was going to, plan on watching on Facebook and missed it for whatever reason it is, we'll leave the comment box open also, so this way you could, obviously you can answer whatever questions they might have about this. But
Awesome.
Yeah, for sure.
But
no, I appreciate your time, and this is just really educational.
Yeah. The connection's a little bit weak. I applaud you for taking the time to do this and to educate the folks in your network. And I'm out here every day. I get about a day off a week. That's about it. But I'm maintaining my positive. I have a team of folks I work with. If you need it, I think Chris will share my contacts on here. Please reach out to us. We're here to help. We're here to support you in any way that we can.
I appreciate this so much, Frank. Thank you so much for taking me. And if you can't help, please let us know. We might provide you guys and be able to send you something amazing, maybe some coffee or some lunch, perhaps. This way we can keep you energized and caffeinated while you're battling this incredible battle for us. We thank you so much for everything that you're doing for us, and putting your life out on the line every single day for us.
Okay, Chris. Definitely, you're very welcome, and we'll stay in touch, and my contacts will be down below.